giving them, Aboriginal people, the opportunity to make decisions for themselves.
Go on and see the value. You know what the most important message in this whole thing is? We learn to see the value in each other.
My name's Lisa. I had a kidney transplant on the 2nd of July 2013. This is my beautiful brother Trent, who literally gave me my life back.
For every living donor, it's one less patient on our waiting list for a deceased donor kidney, so they help the general community as well.
The undoubted success of the scheme is a consequence of the generosity and qualities of the volunteers. They give their time freely and generously.
They express such joy and gratitude when I go to see them. It gives me pleasure too.
Even though we always need more, we really are a very privileged and well-resourced, high-quality health service with some of the smartest and most energetic healthcare professionals. And the responsibility to do better is not lost on any of us.
What the Centre for Education and Workforce Development really does is it provides development opportunities for the workforce of Sydney Local Health District.
We recruit the best and we want the best to keep on being the best.
Just know CWD is here and it's here to help you and enhance your skills.
This is your Centre for Education and Workforce Development. It's your career, your development and your opportunities.
Hi David, how are you going?
I came to find hospital in the home due to an infection in my spine.
Just take your temperature.
When you do get to people's houses and you see what's going on around them, you know, with kids and families, and it's just wonderful that they don't have to be sitting in a hospital bed when they don't need to be.
This enables them to be able to come together with other cancer survivors to get support, but also to be able to do it in not an institutional type of way.
I love the fact that this centre is going to go much more holistic. I think that this centre will help people find the courage and the tenacity to cope.
I congratulate and thank you for taking this time today to reflect not only on the gains made to date, but also to consider where all this knowledge and discovery might take us in the future.
I was actually 10 months old when the authorities came in. Both my parents were there when the trucks rolled in and took us to Nudgee Orphanage.
Before that hospital was built, the death rate for women just to have a baby was 1 in 12. Now, for the last 12 months in that hospital, there's not been one death of a mum.
So if each person's giving $1 a week, it's enough to transform.
The process of care will be very suited to what patients need, be it physical, emotional, or just providing a safe environment for grieving to occur.
Well, I was on the Disability Action Plan Committee, and I was very pleased that somebody listened. And quite often that's all it takes.
I recall being told once, it's not about the journey, it's about the destination. I think child health is not only our destination, but it is our future.
I love coming here. I'm here every week.
The story of Sydney Dental Hospital is filled with a history of quality services, teaching, education and partnerships.
The hospital has provided dental care and services to hundreds of thousands of people and continues to be a place of education and learning for many of the nation's finest dentists and dental staff.
My husband Scott was an organ donor. He passed away following complications from swine flu.
It is a gift. It is a gift of life. And I do thank all. I thank all donors.
We're also making sure that we've got coverage for organ donation, for transplantation, 24 hours a day, 7 days a week.
Durrell is beautiful. I'm glad that you opened it up to bring people in. It's a great place for families, sharing all this information.
All the pictures were really enthusiastic, and you can tell they were really committed about their idea.
Really original, innovative. They sold their pictures extremely well.
Fabulous ideas, so we think this is really going to make a difference.
So people living with mental illness are more likely to die young from physical health conditions like diabetes and heart disease.
The average life expectancy is some 20 years less.
It's really important that people who are working with or caring for people with mental health issues are also looking at physical health.
Everybody gets older. By understanding how we age and the diseases that come with the ageing process, we hope to be able to improve the quality of life for everybody.
This is just absolutely outstanding. I can't imagine a more amazing facility, but more importantly what's going to happen inside and the transformational difference that's going to make.
Provides opportunities for nurses to engage with consumers more. There's comfortable spaces and private areas.
I'm sure that those patients will receive the care equal to the best in the world, and that's what's important.
Health literacy isn't just about reading pamphlets, it's about improving access to health information, capacity to use that information effectively, and it's critical to empowerment.
My dad took me to the doctor's and he got my needles done. Mum said I was screwed when I got my needle.
At the going down of the sun and in the morning, we will remember them, lest we forget.